Ebola is now in the U.S., of course, so we wanted to know how prepared EMS workers in Detroit would be when they had to transport a patient infected with the disease. Today, our Ronnie Dahl spoke to the president of the Detroit EMS Union about whether medics in the city are properly trained to handle an Ebola patient. She joins us now live from the public safety headquarters in downtown. So, Ronnie, is he worried at all?
He definitely is, Joe. Concerned for the medics. He says they have not been given proper training or equipment to handle this contagious disease. However, the division of the EMS's chief, she disagrees. The Ebola virus now responsible for more than 4,000 deaths, including one in the U.S. The Centers for Disease Control is putting medical professionals on alert, warning those on the front lines what to look out for. But in the city of Detroit, the president of the union representing EMS workers says enough isn't being done.
We're ill prepared to mitigate any problem, and really we do not have the proper equipment or training to address these issues.
Joe Barney is concerned for the medics' safety. With reason, just today it was announced 2 medics in New York were being quarantined after transporting patients possibly exposed to the virus. Barney says Detroit lacks a policy and administrative guidance on how to handle possible exposure to the deadly disease.
If there is a possible contamination, what do we do? Is the vehicle quarantined, the crew quarantined? Who notifies the state? We need to be out front, and we need to be addressing it now, not when somebody all of a sudden contracts Ebola, because it's here now.
Angela Turner is the chief of Detroit EMS.
We're following the guidelines that we have used for blood-borne pathogens in the past. With this breakout, it's an alarm for us, and we've taken every precaution necessary to put in place for the employees and the citizens.
Here in the state of Michigan, would the policy call for if they believe someone is exposed, would the medics be quarantined, the rig quarantined, and then who would notify the state?
All decisions about quarantine would be by the local public health officials. The only person who has the legal authority to quarantine someone in a situation like that would be a local public health official.
So there appears to be a difference of opinion between these two organizations. Of course, now is the time to ask those questions and get things clarified. Right now in the state of Michigan, there have been no cases of Ebola. Governor Rick Snyder has announced there is going to be joint training among all of the healthcare professionals in order to try to tackle this problem if it does come here. For now, we are live in downtown Detroit. Back to you.